Mr. President, this week, Dr. Michael Osterholm, the director of the Center for Infectious Disease Research and Policy at the University of Minnesota, and Neel Kashkari, the president of the Federal Reserve Bank of Minnesota, Minneapolis, published a plan to save our health and our economy from the ravages of coronavirus 19. They advised us to strictly shelter at home nationwide for the next 6 weeks. Strictly shelter, to leave home only for food and for medical care for a full 6 weeks in an effort to decrease the transmission rate of coronavirus to less than one new case per 100,000 people. They specifically referenced the Minnesota experience as a case study, suggesting that we had shut down too softly, where even at the peak of our stay-at-home order, we had 78% of workers still reporting for duty. And they advised us to link reopening with extensive testing and contact tracing, case isolation, and close monitoring of positive cases. What is most discouraging about reading that article is that after sitting in this chamber for the last 6 months, it is clear that the majority party here does not have the wisdom or the appetite to do even a fraction of what they suggest. In fact, it is clear that if we had not been rescued by Governor Walz's executive authority, this Senate would have thrown Minnesotans into the furnace of a blazing pandemic. The coronavirus 2019 is a natural disaster which approached our shores in late January of this year. During previous natural disasters or overwhelming external threats, our country has united and set down partisan arms for the preservation of America. Minnesotans had a right to expect us to do the same. Instead, Republicans in this chamber and in the other chamber have repeatedly stood on this floor and shouted at the governor to reopen this state, open our schools, liberate Minnesota, while many of us were hesitant to declare the best policy to manage a pandemic without first seeking advice from people who study infectious diseases. Our Republican colleagues brandished their ignorance and unstudied confidence as a badge of honor. In the words of the old adage, they were seldom correct, but never in doubt. There have been exceptions. Senator Benson has studied this virus as thoroughly as anyone here. Senator Rosen has been farsighted about the economic implications of a pandemic. These exceptions are the more striking for their lonely echoes. The list of blatantly incorrect ideas coming from the other side of the aisle is eye-popping. While it is long and staggering in its wrongness, it has not shaken the confidence of its purveyors in the least. On the contrary, they seem to take energy from yesterday's mistakes to plunge into even greater mistakes today. Republicans said that the coronavirus 2019 is a mild 3-day flu-like illness. Even while morgues overflowed in New York City and young people accumulated in our intensive care units with bizarre new strokes and blood clots to the lungs, Republicans said that cloth masks were ineffective and ostentatious, while the simple mechanics of droplet spread have been understood for years and easily explain the value of masks in blocking transmission of the virus from one person to the next. Republicans scornfully disdained social distancing, again with a confidence that was unsupported by any legitimate voices from the medical community. Republicans said that our approach should be tailored to individual communities or single businesses, while Dr. Osterholm and Mr. Kashkari advise us that this fire can only be extinguished by a blanket which covers every inch of this state and of this nation. Republicans said that COVID-19 is a metro problem and not a rural problem. The audacity of daring this virus to prove this particular assertion wrong, as it has done and will continue to do, is breathtaking in its implications for small rural hospitals and for our greater Minnesota neighbors. Republicans said that COVID-19 doesn't affect young, healthy people, and the best strategy is to isolate our seniors and medically vulnerable and let everyone else go about their ordinary lives. This is factually wrong, but it also demonstrates a crude and simplistic view of public health. The analogy here was if we allowed floodwaters to rise up in our house, up through the basement, into the kitchen and the living room and through our bedroom, but we took our jewels and secured them in a plastic bag. I suppose when the waters receded, we could pull out our jewels and be grateful that they had been kept dry, but it wouldn't be much of a celebration. And in fact, in this analogy, the jewels would be wet anyway, because rising waters like viruses find their target. Republicans said that the death count from COVID-19 was being overstated by a conspiracy of healthcare providers and medical administrators who were exploiting the pandemic to make themselves rich and to keep the people of a state of unreasoned fear. In fact, the numbers show that when we compare 2020 deaths from all causes to previous years, we are drastically under reporting deaths from this coronavirus. Furthermore, if hospitals thought exaggerating a pandemic was a good strategy to bring in profits, they have been rewarded with a generational economic loss. But of course, they never did. They acted responsibly and early at a great financial loss to shut down elective procedures, preserve personal protective equipment, and try to care for the people of our state. Republicans said that hydroxychloroquine is a miracle drug, cheap, effective, and safe for use in either outpatients who have been exposed to the virus or in patients who are critically ill. In numerous controlled trials, that has been proven false. Hydroxychloroquine is neither effective nor safe, and it should not be prescribed. Some will take offense when I call these Republican positions false or wrong. We live in a time when false statements repeated loudly and frequently by politicians gain a foothold, and the very idea of calling something false may seem naive or outdated. But many of us remember a time when the truth was a thing that stood alone, unassailed by political slings. We remember that facts are stubborn things, and we stand prepared to defend them. Here's the truth that Minnesotans know. Republicans led by President Trump are wrong about this virus, and it has cost them their jobs. It has bankrupted their businesses. It has closed their schools. It has ruptured their families, and it has killed them by the hundreds of thousands in a slow, tortured, and withering death. We know from the experience of other countries that this was not inevitable. If Republicans had believed in science, if they had humbled themselves sufficiently to listen before they spoke, to learn before they declaimed, we could have shut down this virus as a unified country this spring, and our children would be buying back-to-school notebooks and pencils right now. We would be going to Target Field together to watch the Twins. And even, had our colleagues been willing in June or July to admit the seriousness of our condition, they could have held hearings on the issues that matter to Minnesotans. Where was the hearing on continuing unemployment benefits? When was the hearing on opening schools safely? What time was the hearing on evictions and the surge in homelessness? These are issues of urgent concern to every one of us. Today, Minnesota parents are combing through a series of bad options as they try to decide how to continue their children's educations, balancing the impossible equation of their own health, their educational advancement, and their duty to the public health. In this difficult task, they have access to the research and advice that Governor Walz has put together with his staff. But if they look to this state Senate for leadership or vision, they will come up empty. Not one hearing has been held, not one proposal has been advanced, apart from the deeply unsatisfactory and cruel advice to open all schools immediately and proceed as though COVID-19 does not exist. This lack of leadership places our students at risk, and it leaves our teachers feeling abandoned and taken for granted. And as anyone who has eyes can see, it is a recipe for a medical disaster. A disaster wherein hundreds of children become infected, they carry the infection home to their families, and they infect the teachers and the staff in their school. I spoke on the floor in April. At that time, I compared this disease to a war, and I said that we were at the Battle of Bull Run, by which I meant that we are in the opening salvos of what will be a difficult and a prolonged struggle for our health and for our economy. 4 months later, Minnesotans are feeling that struggle hit home. Their unemployment benefits are running out. They can't come up with money to pay the mortgage or the rent, and their relatives increasingly fall ill with a virus that Republicans said would vanish by Easter. As they seek answers and guidance, as they seek help so that they may stay alive and get back to work, Governor Walz has been with them every day. His administration has worked tirelessly to provide the best health advice available, to make testing available and free, to make masks free, to balance the needs of small businesses with the mandates of public health. Looking back, I'm sure we can all find missteps. As we learned more, those missteps were corrected. We tried something, we watched and learned, we tried something else. Isn't that what we have always expected of our best leaders? There has been no such leadership or self-evaluation from the Senate Republican caucus, who has persisted in denying the medical reality of coronavirus, insisting on a full and immediate return to normal business. In communities in other states which have adopted that advice, it has been proven to be physically impossible. As workers and customers became ill, and once open businesses closed down again, and it has been demonstrated to be morally bereft, as neighbors and friends died due to bad policy. And now we have this motion to rescind the governor's executive powers and give Republicans control over our path forward. No, thank you. No. Our Republicans, our colleagues, have amply demonstrated their inability to understand our current situation or to deal with it responsibly. We have been rescued from disaster only by the studiousness and leadership of Governor Walz through these executive orders, and with the passage of months, Republicans have not moved in their ignorance or intransigence. So on this moment, this movement to rescind the governor's executive powers during the full storm of this pandemic, to close our eyes and plunge headlong into the howling darkness of the virus, I will vote no, as should every senator who values the health and the livelihood of our citizens.